All right, good morning. Thank you everyone for joining today's electronic visit verification public meeting. We do apologize for the issues that we experienced in rescheduling this meeting to today, but we want to thank you for being able to accommodate and for joining us. So just some general housekeeping before we get started. All phone lines are muted. Questions should be submitted through the chat feature. We will not be answering questions submitted during today's presentation live. Those questions will be addressed after the presentation through listserv communication. And we do ask that you do please reference the slide number in your question if it is specific to a slide that is featured today. So with that, the agenda for today's meeting is we're going to hear from the Office of Medical Assistance Programs on some updates on their EVV implementation. We'll then hear from the Office of Developmental Programs, or ODP, on their updates. Then Kristen will provide some updates from the Office of Long-Term Living. Then we'll go through some EVV compliance reminders. We'll also go through the alternate EVV certification process, similar to what we did during the last public meeting, since we have had a number of questions still about that process. And then we'll go through some frequently asked questions at the end of this presentation. So with that, I will turn it over to Eleanor Doherty in OMAP.
Hello. We'll get right into it. For EVV implementation under OMAP, Section 12006 of the 21st Century Cures Act requires all states to implement the use of EVV for Medicaid-funded personal care and home health care services that require an in-home and community visit. EVV must be implemented for personal care services by January 1st of next year, 2021. EVV must be implemented for home health care services by January 1st, 2023. The Cures Act requires that EVV systems must collect and verify the following 6 elements: service performed, name of the MA beneficiary who receives the service, date of the service, location of the service, name of the individual who provides the service, and the time the service begins and ends. Personal care services are provided to MA beneficiaries under 21 years of age in the beneficiary's home and community settings, prescribed in accordance with a plan of treatment and provided by a home health aide under the supervision of a registered nurse. Personal care services consist of services that support activities of daily living, such as ambulation, bathing, toileting, beneficiary transfers, for example, transfer from bed to chair, chair to bed, and personal hygiene. The implementation of EVV does not impact the provision of PCS. EVV does not change the method and location for personal care service delivery. MA bulletins detailing EVV implementation procedures and timelines have been developed that detail requirements. The bulletins have an anticipated issuance of mid-July, so that's in a couple weeks. Under the fee-for-service delivery system, procedure code S9122 is used to designate personal care services. No modifiers are associated with this code. Physical health managed care organizations use the following procedure codes and modifiers to designate the personal care services. And you can see a list of them, the various modifiers, provider type specialties that are appropriate. And you'll see more details of this in the upcoming OMAP bulletins. Fee-for-service providers must either use the DHS SANDATA EVV system or procure an alternate EVV system of their choosing. If providers use an alternate EVV system, it must interface with the department's EVV aggregator, and these providers must complete the alternate EVV certification process. Physical health MCOs must procure an alternate EVV system. Network providers must procure an alternate EVV system that interfaces with the MCA alternate EVV system. And the PHMCO alternate EVV systems must also interface with the department's EVV aggregator. Alternate EVV technical specifications will be available in the future on the DHS website. And fee-for-service providers using the DHS SANdata EVV system must complete provider training in one of the following ways: either instructor-led via webinar, or online self-paced training using SANdata's learning management system. Providers and physical health MCOs using an alternate EVV system must complete all training specified by the applicable vendor. Under the fee-for-service delivery system, upon completion of provider EVV trainings, the department requires provider administrators to identify which EVV systems they use to capture and submit EVV data to the department's aggregator. The department is currently working on a process to how to, as far as collecting this information. Fee-for-service providers are expected to be using either the DHS EVV system or the alternate EVV system of their choosing no later than September 1st, 2020, and that's coming up soon. PCS claims with a date of service on and after September 1st through November 19th, 2020 will be matched to information in PROMIS and compared against information in the EVV aggregator. If the information does not match, an error status code will be listed. Claims will still pay during this time period. Beginning with dates of service on or after November 20th of this year, claims posting error status codes 927 or 928 will deny payment. Personal care services claims for PHMCOs with a date of service on and after November 1st, 2020 will be matched to information in PROMIS and compared to information in the EVV aggregator. If the information does not match, an error status code will be listed. Claims will still pay. Beginning with dates of service on or after January 1st of next year, the above referenced physical health MCO claims will deny payment. As far as communications, March 6th of this year, a letter went to fee-for-service home health agencies to advise them of the EVV PCS requirements. June 16, a more all-encompassing MA bulletin was issued. And mid-July, we have an anticipated issuance of the fee-for-service MA bulletin and the physical health MCO MA bulletin. Information on training will be in the MA bulletins.
Thank you, Ellie. And now we'll have Chuck Frick from ODP provide some updates.
Great, thank you, Britt. Okay, obviously for ODP, we want to, right now, we're really focusing on participant-directed services. As everyone know, we started training in June, the first 2 weeks in June, with our go-live date for EVV with Palco. So if you're a common law employer, you should have received directives already. All participants directed services will require EVV compliance with EV options with Palco are mobile app via smart device or telephony IVR via the participant's landline. And then we also, for the Palco website, we put a link here for training material to sign up for to attend trainings. So just click on that link and you know, it will get you started. It has all the FAQs on there already. So again, please go to that link to see additional information. For EVV communication training materials, registration form, everybody should have received a lot of this information already. If you have not, please contact the Palco mailbox again. So one of the things is that going to be nice is Palco is going to have training every week. We had, like I said earlier, we had training in June for the first 2 weeks. We had a lot of training. Most CLEs and participants who use self-direction have attended the trainings. But for new individuals to PDS, and in July and August, we will have continuing trainings in every week through July and August, and therefore afterwards too for new individuals. All right, next slide, please. Okay, obviously, as Eleanor said earlier, we will, I'm sorry, she did say about a bulletin, but also ODP and OLTL, we're working on a joint bulletin as well. It's coming out in July. So there's going to be a lot of the requirements and expectations, that the parameters that we set forth in that bulletin. On a side note, I just want to make sure that for ODP providers, we are looking at the data through the process of who's in the EVV system, where you're at in the steps for especially all EVV providers. We are making phone calls right now to providers. So if you do see an email from ODP, especially from me, this is Chuck Frick, that you know, that is to find out your status with the EVV system. Also, we'll be sending emails out to providers in very near future. So be on the lookout. That again, it's to find out your status as an ODP provider, to where you are at, and if you're having any troubles or issues or anything of that nature. So again, we're really pushing our communication and really trying to reach out to providers during this time frame. So if you see an email or communication from us, please respond to it. Okay, next slide. LTO, we'll take it over to Kristen.
Thank you, Chuck. And before I get into the main OLTL update I want to cover, I just wanted to build on what Chuck said for outreach that we'll be conducting as well. The Office of Long-Term Living is also completing analysis of provider activity as it relates to claims in the DHS aggregator, and we're specifically focusing on fee-for-service for some direct outreach. So please keep an eye out for emails in the near future. If you receive one of those direct emails, that means that we're having difficulty determining your status, and we are seeking an update so we can assist you if necessary with overcoming any barriers you're encountering with implementing EVV. So the main update I wanted to cover was related to the implementation process for OLTL providers. Since OLTL providers are in a unique situation because OLTL has both a managed care and a fee-for-service system, some providers may be operating only in Community Health Choices managed care program, while others may be operating in both Community Health Choices and still serving participants in the Act 150 and OBRA waivers. So it's extremely important for providers to make sure that you are properly implementing EVV for every program that you are participating in. It's important to remember that EVV data is being used to support claims activity. So if you are sending your claims to Promise, you must also send your EVV visit data to the DHS aggregator. Or if you are sending your claims to a managed care organization, you must send the EVV visit data to them. So for OLTL providers who are still serving participants in the OBRA waiver or Act 150 program, you must implement EVV for these programs by either completing the training and using the DHS EVV SAN data system, or integrating an alternate EVV system with the DHS EVV aggregator to send EVV data for OBRA and Act 150 participants, or you need to work with HHA Exchange and the appropriate managed care organizations, if applicable, to send OBRA waiver and Act 150 EVV data separately from CHC data. And this is not an automatic process just because you may already be using HHA Exchange or an EVV system with the Community Health Choices Managed Care Organization. If you were to seek to take this step, this is an additional action providers must take to move forward with that process. This is a point we really want to drive home because as we're analyzing the current EVV utilization data, we are seeing a large proportion of providers using EVV in Community Health Choices. However, the majority of those same providers do not have EVV visit data, or the EVV visit data is very low for the DHS aggregator for fee-for-service claims. Next slide, please. And with that, I think we'll hand it over to Britt.
Thanks, Kristen. All right, so now we want to just walk through some compliance reminders because we are getting closer to that October 1st, 2020 date for ODP and OLTL providers. So we wanted to remind you that Pennsylvania is expecting all ODP and OLTL providers use EVV regularly now to prepare for the October 1st, 2020 claim denials deadline. Just a reminder that we are currently in an extended soft launch period where there is no impact to claims. And this, we feel, is allowing you time to become familiar with EVV. So that could include training staff, but also making sure that the EVV data is being captured and is flowing through to the aggregator. EVV data from alternate EVV systems must flow to the DHS aggregator in order for providers to be in compliance. And providers are reminded that you should only submit for billing after EVV data has been submitted to the DHS aggregator. We've covered this a number of times in the past, but it's always good to remind you that we are using an open model. So this allows for providers to use those third-party or alternate EVV vendors. And all the systems must flow into the DHS aggregator. So you'll see here that the DHS SANdata EVV system, which is used by fee-for-service providers, that flows into the aggregator. The CHC MCO's EVV system, or HHA Exchange, that flows into the aggregator. The fiscal employer agent alternate EVV systems, which are fee-for-service, flow into the aggregator. And then, of course, the alternate EVV systems and for fee-for-service also flow into that aggregator. And when an EVV service is on the claims transaction, the claim is validated against the EVV visit data in the DHS aggregator. So you'll see that we've added that box at the bottom to show promise and how it interacts with the aggregator. So we just wanted to remind you that EVV data is feeding into the DHS aggregator. Promise checks against that data in the aggregator. And the aggregator integrates data from all EVV systems, including alternate EVV systems. And the DHS aggregator includes a read-only web portal for the provider to view data. If you are a provider using your own solution, you need to be sending your files to the aggregator. For those who are using the SANdata EVV solution, that information already goes separately, so you do not need to do anything if you are using the DHS SANdata EVV solution. Although the SANdata information does go directly to the aggregator, you still need to verify the information in the SANdata system. So edits for ODP fee-for-service went into effect for claims submitted beginning November 1st, 2019, for dates of service November 1st, 2019 and after. Edits for OLTL fee-for-service went into effect for claims submitted beginning December 13th, 2019, for dates of service November 1st, 2019 and after. And edits for OLTL CHC went into effect for claims submitted beginning March 3rd, 2020, for dates of service January 1st, 2020 and after. So we just wanted to reinforce the ESC or our status codes. So we've listed out the EVV ESCs are ESC 925, ESC 926, ESC 927, ESC 928, ESC 929, ESC 930, and ESC 931. And you'll see that we've noted the resolution that needs to be made relatively to those ESCs. The two most important ESCs that we want to make sure that you're aware of are 927 and 928. We did cover those in more detail in the last presentation, but we wanted to make sure that you are aware of these. 927 is the units billed exceed units verified in EVV. And when this occurs, the provider needs to review visit data and claims units make corrections where needed, and then resubmit the claim. For ESC 928, this is the EVV visit is not found. And the resolution is that the provider needs to review and ensure the EVV record is found in the aggregator, contains valid data, and then resubmit the claim. So just a little bit more detail on the 928. ESC 928 posts under the following conditions. The first is that there is no EVV data found in the DHS aggregator at the time the claim was processed. Or the second condition would be the visit is not in a verified status. Or the third is a mismatch was found between the date of service, the recipient ID, the procedure code, or the provider's MPI on the claim versus what is in the EVV record. So providers not yet sending EVV data to the aggregator would see all of their claims post as ESC 928. And we want to remind you that the EVV ESC's document can be found on the EVV website with the link here. So as both Kristen and Chuck mentioned previously, we are reviewing the data that is being captured in the aggregator at this point. And we are reviewing the ESCs that are posting. So for the fee for service under OLTL, the ESC 925 is posting approximately 3% of the time. And these numbers are for May 2020. And I should also point out that these are the number of service lines that are posting these ESCs for May 2020. So for OLTL fee for service, ESC 927 is posting less than 1%. And for ESC 928 or EVV visit not found, it's nearly a little over 96%. And again, we want to point out that ESC 927 and ESC 928 will both deny beginning October 1st, 2020. So then for ODP, which also is fee for service, ESC 925 is setting approximately 14% of the time. ESC 927 is around 2%, and ESC 928, or that EVV visit not found, is approximately 84%. And then in CHC, EVV ESC 925 is setting approximately 45% of the time. 927, ESC 927 is approximately 2%. And then ESC 928, or that EVV visit not found, is approximately 53%. Also wanted to note that providers who believe they received an ESC 927 or ESC 928 on their claims and encounters for personal care services in error should contact the Provider Assistance Center or PAC line at 1-800-248-2152 or by email at papac1@dxc.com. And those contacts will be featured later in the presentation as well. So we just wanted to remind you that a verified status visit is one that has all the required data elements and no outstanding visit exceptions. The following definitions are used for visit statuses in the DHS SANDATA EVV system, which can be found in the EVV SANDATA training guide on our website, and that does hyperlink directly there. So you'll see an image of those visit statuses. And again, this is specific to the DHS SANDATA EVV system. It shows the status is in process, where a visit has started and not yet completed, the status of incomplete, where a visit has exceeded a 24-hour period and is still missing a call in or call out, the status of verified, which a visit that does not contain any exceptions, the status of processed, which means a visit that does not contain any exceptions and has been returned to the claims validation engine at least once, and then also the status of omit, which means a visit that is marked do not bill. So a verified status will also show under the visit status in the DHS aggregator portal for those of you that are using an alternate EVV vendor and have access to the aggregator portal. Again, that is read only. And you'll see here there's a column that says visit status that we've circled in red. And on this, you'll note that they are listed as incomplete. So the provider would have to go in and make those corrections in order to get it to a verified status. So EVV ESCs are part of the billing process and are found in Promise. Providers will need to go into the Promise Internet portal to see the ESCs that we'll set. For ODP providers, the ESCs also will be in the trade files, which are also known as payment files, which are run on a Saturday. So the trade files contain the claims processed from Saturday, 12 a.m. to Friday, 11:59 p.m. Some providers are editing all visits to align perfectly on the 15-minute unit, and these edits should not be occurring. These are considered manual edits and will apply towards compliance thresholds for manual edits, which will be enforced after October 1st, 2020. So manual corrections should be done on an exception basis only, and in situations when all electronic capture options are unavailable. Manual corrections in EVV are accepted, but should never be the primary method of visit capture information. When we're saying primary method of visit capture, that refers to mobile, telephony, or fixed visit verification, depending on the system that you're using. We're talking about that actual electronic capture of the information. Future compliances will be mandated to ensure a majority of provider visits are performed through primary method of visit capture. Supporting hard copy documentation should be kept for manual corrections, and we wanted to make sure that you understand that hard copy documentation is determined by the provider, but what we're referring to is a paper copy. But again, that is up to the provider to determine what that paper copy is. Even if a visit is captured electronically, but an exception sets and is corrected, the record would be classified as a manual correction. Acceptable reasons for a manual edit are you are missing required visit information, that is one or more of the required items, or you have to make a correction or change to one of the data elements because it was incorrect. So the service or the participant, the caregiver, the agency, or the time of care were incorrect, so you needed to go in and change that to make it correct. EVV compliance related to manual corrections will be shared in the future through the release of the MA bulletins. Compliance thresholds are not being enforced at this time. We are still in that soft launch period, but per CMS guidance, DHS is monitoring providers and will be contacting them to provide technical assistance. And again, Kristen and Chuck referenced this earlier. We have started to do some of that outreach to providers. But again, providers should be working to keep these manual edits to a minimum. So really quickly, we wanted to just provide an update on the EVV compliance survey that was sent out months ago. A reminder that if providers have not completed this survey to date, you should still complete the survey as soon as you can. We have left the survey open to receive additional responses. We need everyone to complete this survey, including fee-for-service and CHC providers. So if you have not completed it, please go onto the website and complete that. Also, just a reminder that it is the provider agency's best interest to complete the survey. It helps to ensure the account is set up accurately for the provider agency. DHS can view how providers are currently submitting EVV data, but the survey is particularly important for providers not currently submitting EVV data and providers planning to change how they will be submitting data. For example, you're currently using the DHS SAN data EVV system until your alternate EVV system is certified. So we need to know if your plans will be changing in the future. DHS will only be able to help support your setup needs by understanding each provider's plans for EVV data submissions. So it is really important that we get this information from all of the providers. As you'll see, we've received 811 total responses as of June 18th. That is approximately 50% of the provider population that we need to hear from. We've included here the question, the second question is, are you currently capturing visits for EVV? And the majority have responded yes, approximately 85% of those 811 responses, and approximately 15% have said no. Another important question is, are you currently using or do you plan to use the DHS SANdata EVV system to capture visits? And the response is approximately 35% are saying yes, and approximately 65% have said no. We wanted to point out here that less than 100 of those identified as planning to use or currently using the SANdata system are showing EVV data in the aggregator. So again, a plea to, if you are planning to use the DHS SANdata EVV system, please use it now. And the last question we wanted to point out on the survey is, where are your alternate EVV systems sending your EVV data? And you'll see here that the vast majority are sending to the HHA exchange, approximately 13% to the aggregator, almost 19% both HHA exchange and the aggregator, and then a little less than approximately 1% not using alternate EVV or only using the DHS SANdata system, and then about 16% said they do not know at this time. And we are conducting outreach to those providers who identified that response to really follow up to see exactly what system you are using. So with that, we'll go into the alternate EVV certification process. So currently we have 35 alternate EVV systems in the testing phase of the process. We have 7 alternate EVV systems that have their testing completed. We have 114 EVV systems that are in receipt of production credentials at this point, and 54 alternate EVV systems have confirmed data in the DHS aggregator. Wanted to make sure that you understand that these numbers represent providers using alternate EVV systems, and that there are 60 providers or alternate EVV systems that have not confirmed data in the DHS aggregator at this point, and need to do this in order to assure the information is coming through as intended. We have approximately 100 providers who are at various steps in the certification process that are not included in these numbers, who have become unresponsive in the certification process. Fee-for-service providers utilizing an alternate EVV system need to contact the SANdata alternate EVV support team to be certified and integrate with the DHS aggregator. So we've included the contact information here, but for those of you that cannot see the screen, the phone number is 855-705-2407, and the email is paaltevv@sandata.com. Just a reminder that the certification process takes approximately 8 to 12 weeks, depending on the testing required, and the process can also depend on whether the alternate EVV vendor is new to the process, as well as the provider responsiveness, as was noted previously. So the total certification process is 8 steps. The first step is the provider downloads and reviews the technical specs and alternate EVV addendum for OLTL and ODP. This process will be nearly identical for OMAP fee-for-service folks that are intending to use alternate EVV systems. But for now, we are just focusing on OLTL and ODP within these slides. But again, it will apply to OMAP fee-for-service as well. The second step is when provider is prepared to test and receive credentials, the provider reaches out via email to the PA Alt EVV support team. The third step is the PA Alt EVV support team at SANdata creates the testing credentials, and the provider completes DHS aggregator training. Step 4, the provider and the vendor work together to conduct testing. Step 5, Once testing is complete, the provider submits the completed testing checklist to PA Alt EVV. Step 6 then, the provider emails to the PA Alt EVV support team at Sandata and identifies the go live date and requests production credentials. Step 7, the provider confirms live data is in the DHS Sandata aggregator. And then step 8, Sandata notifies the provider of Alt EVV testing completion via email. Again, it is really important that providers understand that you need to get through all 8 steps to actually be certified. So it is extremely important once each stage in the testing process is completed, providers move to the next stage without any delay. Many current delays in the testing process are due to providers not initiating the next steps in a timely fashion, and it is expected that providers move between stages immediately. If a provider decides to opt out of alternate EVV testing for any reason, you should email pa.altevv@sandata.com of this intention. We want to make sure that we understand that you are not continuing the Alt EVV process so that we don't continue to reach out and send you emails related to it. So any provider intending to use an alternate EVV system for fee-for-service services must begin the testing process no later than July 1st, 2020, which is right around the corner. Providers starting this process after July 1st, 2020 will run the risk of not being able to meet the October 1st, 2020 claims denial deadline. We really want you to succeed and not have your claims denied come October 1st, so please do not wait. It is the provider's responsibility to follow up with their vendors throughout the entire certification process. So this slide is relevant to step 4. We are really going to focus in on those steps where we're seeing most providers getting hung up in the process. So step 4 is where we're seeing a good chunk of providers getting hung up. In step 4, the provider and alternate EVV vendor work together to conduct testing as the alternate EVV support team at Sandata assists with any issues or errors encountered. This is by far the lengthiest of all the steps and can take between 2 to 12 weeks. So it is recommended to begin sending data immediately so any barriers and data issues can be addressed by Sandata alternate EVV support team. Addressing issues early can help reduce time later in the testing process. During this step, you're reminded to please monitor emails regularly. It is important to note that Sandata, the vendor, and the provider should be included in all emails. Alternate EVV vendors are not permitted to correspond with the alternate EVV support team at Sandata without the provider inclusion. And in the event an alternate EVV vendor requires a phone call with the alternate EVV support team at Sandata, the provider must give written consent in the step 4 support ticket. This consent is only for one call and is necessary to ensure all parties are kept informed throughout the entire step 4 process. Once step 4 has been completed, it is important to move to step 5 without any delay. So in step 5 then, once testing is complete, it is important for the provider to immediately submit the completed testing checklist to the PA alternate EVV support team at Sandata for validation of successful completion. The alternate EVV support team at Sandata will review the checklist and email the provider their results. Please allow 5 business days for a response from Sandata. If the provider does not pass, this again is in step 5, if the provider does not pass, the email from the alternate EVV support team at Sandata will indicate which item in the checklist needs review or correction. The provider will resend the checklist back to the alternate EVV support team at Sandata in the same support ticket until they pass. Once a checklist passes or is deemed completed, the provider may move to step 6. And once again, it is really important, once step 5 is completed, the provider should move to step 6 without any delay. So then in step 6, providers will email the PA-ALT-EVV@sandata.com to request their production credentials within 5 business days of passing their checklist. In that same email, the provider will indicate the date they wish to transmit their live data to the DHS SANDATA aggregator, aka the go live date. This needs to be completed within 10 business days of the provider's receipt of the go live email. The alternate EVV support team at SANDATA will then respond with production credentials and verify the provider's go live date. So transitioning from stage 6 to stage 7, this is where SANDATA and DHS are seeing the biggest delays due to providers requesting delayed go live dates. Providers really should go live within 10 business days of receiving production credentials. So in step 7, on the go live date, the provider will log into the DHS aggregator and verify that live EVV data is flowing correctly into the read-only production DHS aggregator. If any data is absent or incorrect, the provider will work with the alternate EVV support team at SANDATA and their alternate EVV vendor to troubleshoot any issues. Once successful data transmission is confirmed, the provider emails SANDATA to confirm successful data transmission in the DHS aggregator. So then we move into step 8. In step 8, SANDATA notifies the provider of alternate EVV testing completion via email, and the certification is actually complete at that step. Again, it requires all 8 steps. So skipping any step in the certification process runs the risk of your EVV data not being compliant and claims being denied starting October 1st, 2020. It is important to monitor your email and spam folders regularly. A quick reference guide for the alternate EVV certification process is available on the DHS EVV webpage. The hyperlink is here. That quick reference guide outlines the steps, all 8 steps, and the expectations for SANDATA, the providers, and alternate EVV vendors. And it does go into more detail. So based on the EVV compliance survey respondents, over 100 providers intend to use an alternate EVV vendor for a fee-for-service and have not begun the testing process at this point. If you have not started the process, you need to reach out to the alternate EVV support team at SANDATA as soon as possible. If you have started the testing process and SANDATA has not heard from you in 30 days or more, you are deemed unresponsive. Currently, there are 98 providers who are listed as unresponsive. DHS and SANDATA are currently working to follow up with these providers via email outreach. So again, check your spam folders to make sure that it's not going into that. So alternate EVV testing and duration. The SANDATA alternate EVV system is available for testing at all times, except during standard release windows. SANDATA can assist with testing results and validation. Participant matching will not be included as part of testing, but will be enforced in production. The duration of testing varies. Testing should continue until the data sent is error-free. And again, a reminder to please monitor email for updates from SANDATA, including your spam folders. Once the testing is complete, SANDATA encourages the move into production as quickly as possible. Again, providers should begin the alternate EVV certification process no later than July 1st, 2020 to ensure that you are feeding that information into the aggregator by October 1st, 2020. When contacting the SANDATA alternate EVV support team, detailed setup information is required, including what systems are used to collect EVV data. Missing information may lead to additional delays for Pennsylvania EVV program compliance. And again, the SANDATA alternate EVV support team may be contacted by phone at 855-705-2407 or by email at PA-ALT-EVV@sandata.com. For optimal system performance, it is recommended that completed visits should be sent in near real time. Alternate EVV completed visit data should be uploaded to the DHS aggregator, and upload frequencies should be set based on provider service volume at a frequency of no more than once a day. It is expected that information is sent as it is added, changed, deleted in the alternate EVV system. Rejection responses will be delivered on a separate API call that is initiated by the third party in near real time. And again, it's important to note here that, as a reminder, you need to make sure that the EVV data is submitted to the aggregator before billing actually occurs. All right, so next we're going to talk a little bit about the DHS SANdata EVV system, since we do have some folks that have not initiated using it who have said that they will be. Reminder that the DHS SANdata EVV system is live. The system is free and available for use by fee-for-service providers. If fee-for-service providers are intending to use this system, you must take the online training and receive a welcome kit, which will provide access to the system. If you are a fee-for-service provider and have completed training, but have yet to receive a welcome kit for your agency, please contact the PAC line at 800-248-2152 or papac1@dxc.com. I know that we've said this a number of times, but just a reminder to check your spam or junk folders for welcome kit and or login credential emails. If the welcome kit has expired, please call the PAC to get the welcome kit resent. So the DHS SANdata EVV Learning Management System, or LMS, is a train-the-trainer model. Agency administrators and supervisors should take training and then train their respective staffs. Self-paced online training is available for new providers or providers wanting to take refresher courses. The registration link is included here. It can also be found on the DHS EVV website. 662 unique provider agencies have completed training and received welcome kits to date. But as we mentioned previously, not all of them are actually using the system at this point. In the recent EVV compliance survey, 79 providers indicated they intend to use DHS SANdata EVV who have not completed training and received their credentials. If you intend to use DHS SANdata EVV system, please do not wait to use the system. Use it now. Just also a reminder that to get a welcome kit in a timely fashion, SANdata needs a minimum of 30 days to complete this whole process, but you will need more than 30 days actually to implement in your agencies, so you should plan accordingly. So for the DHS SANdata EVV system, who needs credentials for the portal login? A provider supporting only fee-for-service participants will require credentials for use of DHS SANdata EVV system, but they will not if the visit data is captured via an alternate EVV system. Also, a provider supporting both CHC, MCO, and fee-for-service participants, they will not require those that portal login if all visit data is captured and submitted to the DHS aggregator via HHA exchange, but they will require that login if visit data for fee-for-service is captured in the DHS SANdata EVV system. So just some helpful tips on using DHS SANdata EVV. The SANdata EVV platform passwords expire every 60 days. Please ensure you're receiving notification and changing your password ahead of time to avoid lockout of the administrative count. All new passwords must be unique. Users are unable to reuse any of the past 24 passwords. It is recommended that after 2 failed attempts to use the forgot password to reset password. And after 5 failed attempts, the user will be locked out. Providers should go into visit maintenance daily, if not regularly, to view all visits and correct any exceptions. Password resets for direct care workers or DCWs should be done by agency supervisors, and direct care workers experiencing issues should report them to their supervisors and or administrators. So the employee module password reset for the San Diego Mobile Connect, administrators' unsuccessful attempts at supplying temporary password for a locked SMC users, please try the following before calling PAC support. Use the search feature under the employee module to query your list of employees. Select the pencil to edit the employee. Deselect the mobile user checkbox found under the hire date, then select save and close. Please wait 10 minutes prior to editing the same employee. That wait time is important. Edit the employee using the pencil again and reselect mobile user checkbox, then save and close. And again, wait 10 minutes before executing the temporary password reset. So in visit maintenance, you should not edit any times unless there is a correction that is necessary. And again, the PAC support line, that information is included here. Just a reminder that there is a press number 1 to prompt for EVV when you call into that 800 number. With that, we'll go into some of the frequently asked questions. And I believe, Chuck, you're going to cover the first one.
All right. Well, thank you, Britt. Thank you for all that valuable information. All right, EVV questions. Let's get started. Question, will there be an opportunity to have a soft launch to get used to the system before being live? Answer, we are currently in a soft launch period until October 1st, 2020 for ODP and OLTL to allow providers to become familiar with EVV and train staff before claims will begin to deny for the lack of EVV data. The ODP and OLTL soft launch period started October 1st, 2019. OMAP fee-for-service soft launch periods will be September 1st, 2020 through November 19th, 2020. Please reference the DHS EVV website for up-to-date timelines. Question. If we are still on a lockdown for COVID-19, how will EVV work with remote services? Answer. Currently, nothing changes for EVV, and be prepared for October 1st, 2020. Question. Will claims be denied if the visit duration exceeds the service authorization form approved hours? The process for authorization hours and claims does not change with EVV. What should I do if the diagnosis code is missing? ODP and OLTL have the diagnosis code on the service authorization. If the program diagnosis code is missing, providers should reach out to the participant supports coordinator to add the program diagnosis code to the care plan. Question. Does a living caregiver have to use EVV in Pennsylvania? Answer, yes. Living caregivers providing personal care services must comply with EVV. Question. Some participants do not have a home phone. Will a home phone be required for EVV? Answer, EVV does not require participants to have a landline home phone. Caregivers can capture their visit information using the application on the smartphone or by calling the telephone number associated with the telephony visit verification system. Question. Can the caregiver use the client's cell phone to clock in and clock out through the telephonic system? Answer. Telephonic verification must include validation through a GPS or location system. Cell phones are not acceptable for telephonic verification unless a location device code is included. Fixed voice over internet protocol is acceptable. Non-fixed voice internet protocol will require a location device code. Question. If a caregiver cannot use the participant's mobile phone for EVV, are participants required to have a landline for the caregiver to call in and out? Answer. Participants are not required to have a landline for the caregiver to call in and out. DHS does not expect a caregiver to use the participant's phone. Although this can be a resource for telephony visit verification, providers are responsible for developing policies related to the appropriate equipment needed for EVV. Will DHS provide phones to participants for EVV? Answer. DHS is not supplying devices for EVV. If necessary, consumers may be able to apply for a device through the Lifelines program. More information on Lifeline may be found on the DHS website. Will there be help with the cost for people who do not currently have data plans? Answer. DHS will not cover the cost associated with data plans. Question. What happens if checked in and or checked out times cannot be or are not captured? Check-in and check-out times are required information that must be captured as part of the visit. In instances where the check-in and check-out times are unable to be captured through the mobile application or telephony, the times can be fixed through manual entry in the web portal. Question. Is a paper timesheet required for missed clocked ins and clocked outs? Answer. Paper timesheets are not required. However, issues or corrections due to a missed clock in or clock out should be noted with the appropriate reason code and supporting hard copy documentation, as best determined by the provider agency, should be available for auditing purposes. Kristen, I think you're on for this.
Yes, thank you, Chuck.
Okay.
And before I begin reviewing the next set of frequently asked questions, I just wanted to address that many of the following questions are in relation to the EVV system that the Community Health Choices Managed Care organizations have chosen to use within their network. And any technical issues or questions related to the EVV system at HHA Exchange should be directed towards the MCOs. Although we can address general questions about how HHA Exchange interacts with the aggregator and the more general EVV policies and how that relates to managed care, if there are technical issues related to GPS location, address, telephone numbers in the system, corrections, anything like that, that needs to be directed to the MCOs and HHA Exchange. We're not able to assist with the details of how every EVV system operates, so they'll really be your best resource. So first question, what do I need to do to be compliant if I have multiple EVV systems to collect EVV data? Multiple DHS aggregator accounts will be required. Visit data from each system will not be commingled in the PA aggregator. Each vendor will have to complete testing with the SANdata team, and production deployments can be completed separately. Next question. What if I have multiple systems, one with HHA Exchange and the Community Health Choices Managed Care organizations, and one with a fee-for-service third-party EVV solution? Multiple DHS aggregator accounts will also be required for this scenario. Visit data from HHA Exchange and the third-party EVV system will not be commingled in the PA aggregator. The non-HHA Exchange vendor will have to complete testing with the SAN data team, and that vendor will have to work with the provider to complete this process. And then production deployments can be completed separately. Are the CHC MCOs required, are Community Health Choices providers required to be certified by HHA Exchange? Providers contracted with the Community Health Choices managed care organizations must be able to send EVV data to the CHC MCOs for their appropriate members. The MCOs will need to complete the certification process with the DHS aggregator to ensure that all data sent from HHA Exchange can be sent and includes the required data for the aggregator. DHS has been working with the MCOs, HHA Exchange, and SAN data to complete this interface process. Next question. We have had EVV for 16 years and currently bill through HHA Exchange. Do we need further certification with SAN data? Any alternate EVV system interfacing directly with the DHS aggregator must complete the alternate EVV certification process. So, if you are operating a fee-for-service program, the alternate EVV system will need to interface directly with the DHS aggregator, and you will need to work through the certification process with SAN data. If you are only operating in Community Health Choices, then you will only need to send EVV data to the CHC MCOs, and you do not need further certification with SAN data. This one is a fairly detailed question and response. So HHA Exchange contacted me and said I needed to make changes to my billing files for EVV compliance. Is it true we need to make the updates that HHA states in their document, including the last 5 digits of the caregiver's social security number? If we have to make these changes, what am I supposed to put in for the service location? All EVV data being submitted to the DHS aggregator must meet the technical specifications and addendum established by DHS, which can be found on the EVV website. Providers using alternate EVV systems in Community Health Choices will need to send their EVV data to the managed care organizations. The managed care organizations will use the data for claims validation and send the data to the DHS aggregator. Therefore, all EVV data submitted to the CHC MCOs must meet the format outlined by the department in the technical specifications and addendum on the DHS EVV website. In regards to the location address and GPS coordinates, services can be provided at home or in the community based on the participant's needs and service plan. You must work with the MCO to resolve any location data issues between your EVV system and HHA Exchange. Next question. Will the DHS SAN data EVV system and HHA Exchange communicate with each other? The DHS SAN data system is not designed to send information to HHA Exchange. However, HHA has an interface to transmit data to SAN data. If a provider is billing an MCO, the EVV data in HHA Exchange goes to the CHC MCO and will also be transmitted to the DHS aggregator. And I just want to take a moment, as we're working through a lot of these questions related to the Community Health Choices managed care system, and we also have OMAP and the Health Choices MCOs being brought in with a new timeline. I just want to make a quick reminder, this is specifically addressing Community Health Choices, and additional guidance related to the Health Choices managed care organizations will be released, and providers will need to work with those specific managed care organizations because the systems that they select and work with may be different than what is currently being used in the Community Health Choices program. So I just want to put that reminder out there as we're talking about managed care. Next slide, please. If an agency is using an alternate EVV vendor and there needs to be an edit made, are they able to access the SAN data portal and make manual adjustments? The SAN data portal to the DHS aggregator for alternate EVV users is read-only. Any edits or adjustments must be made in the alternate EVV system, and the visit then needs to be resent to the DHS aggregator. If my alternate EVV system vendor already went through the SAN data alternate EVV certification process, do I need to complete the certification process also? Yes. Even though a different agency has an approved interface from an alternate EVV vendor to the DHS aggregator, each provider agency must complete the testing process to ensure the interface works with the alternate EVV system and to gain SAN data's approval. What if my alternate EVV system vendor cannot map its values to the DHS EVV system field values? The data in the DHS aggregator must be consistent across the EVV program. Therefore, alternate EVV systems must send the same values in the format and manner specified in the technical specifications. Providers may use the DHS SAN data EVV system if the alternate EVV vendor cannot accommodate the values, format, or interface requirements defined in the alternate EVV technical specifications. As mentioned before, these specifications are available on the DHS EVV website. And last question before I transition to Ellie. What if a provider wants additional EVV features not offered by the DHS SAN data EVV system or HHA exchange? DHS recognizes that some providers may already be using or may seek to explore systems that provide more services and information than required under the EVV structure for all of the provider's program needs. Certain vendor systems, including HHA and SAN data, may provide this additional functionality. Any such vendor system will need to be compatible with the DHS EVV solution that is provided through SAN data or HHA exchange. Please be advised that DHS does not endorse the use of any particular system, upgrades, add-ons, or additional services from any vendor, nor should providers be led to believe that such services are suggested or required by the Department, the Commonwealth of Pennsylvania, or the federal government. DHS is responsible only for ensuring that EVV requirements are implemented pursuant to federal law. And with that, I'll hand it off to Ellie for the next round of questions.
Thank you very much. First question, can a provider agency only send billed visits and only once a week? The answer, for optimal system performance, it's recommended that completed visits should be sent in near real time. Alternate EVV completed visit data should be uploaded to the DHS aggregator and should be set on provider service volume at a frequency of no more than once a day. It's expected that information is sent as it is, added, changed, deleted in the alternate EVV system. Question, who is able to use the DHS SAN data EVV system? And the response, the DHS SAN data EVV system is available for providers with fee-for-service clients. The system is only to be used for personal care services at this point in time. Question, how do I know if my claims were accepted or rejected? And the answer, provider agencies will continue to use the same process you use today to see if your claims were accepted or rejected. There should be few rejected claims since the DHS SAN data EVV system makes sure you have all the required claims data prior to submission. For providers using the DHS SAN data EVV system, training is available to show how to resubmit claims through the DHS SAN data EVV system. Question, how secure is the data that is transmitted through the DHS SAN data EVV system? And the answer, regarding data breach concerns, DHS has taken every precaution to ensure our systems are resilient and meet the Commonwealth's IT policies. The SAN data platform is Health Insurance Portability and Accountability Act, HIPAA compliant, and is Health Information Trust Alliance certified. And the last question for me, What is the exception generated by the DHS SANDATA EVV system? The answer: for the initial phase of EVV implementation, exceptions are generated by the DHS SANDATA EVV system when one or more of the 6 required items is missing or invalid. For providers using alternate EVV systems, the alternate EVV technical specifications included on the DHS EVV website detail the information that must be captured and submitted to the DHS aggregator. And on to the next one.
Okay, thank you guys. So just really quickly, since we're getting towards the end of this, we wanted to once again go over the EVV contacts. For COVID-19 information, there is a website specific to COVID-19 information on the DHS page, and that link is included here. For program-related questions related to EVV, there is the resource account. That's RA-PW-EVV notice at pa.gov. For DHS SANDATA EVV system questions, please contact PAC support. We've gone over that a number of times, but the email is papac1@dxc.com. Alternate EVV users not using HHA Exchange, you should reach out to the SANDATA Alternate EVV support team, and that's PALTEVV@sandata.com. And HHA Exchange Alt EVV system questions should be directed to the HHA Exchange support team, and that email is support@hhaexchange.com or paintegration@hhaexchange.com. Just again, some reminders on contacting EVV support. Alternate EVV vendors may not understand your agency processes. Please be as detailed and descriptive as possible so support teams understand your issue to the best of their ability. Screenshots, of course, are always helpful. If you have specific examples or screenshots, though, always send those securely due to PHI. If a provider is working with an alternate EVV vendor and has a ticket number, please provide the ticket number. That is extremely helpful on our end. Check your spam folders regularly for emails from DHS, SANDATA, HHA Exchange, or other approved listservs, programs, or agencies. And we just wanted to make sure that you had the link for the DHS EVV website. We've also included here a screenshot of what it should look like when you do access it. You'll also notice that there are additional resources in that right-hand column that will take you directly to the alternate EVV technical specifications, as well as the public meeting information. We will have some additional public meetings. Those dates will be posted to the website. The next one will be July 30th from 1 to 3 p.m. We'll have one in August on August 28th from 1 to 3. We'll have one in September on the 25th from 1 to 3, and then we'll also have one in October on the 23rd from 1 to 3. And again, this information will be shared out via the EVV listserv and will also be posted to the DHS EVV website, along with the links on how you can register for those public meetings. With that, we want to say thank you so much for joining us today. This presentation, as well as the recording, will be posted to the DHS EVV website under that public meeting tab. Any questions that were submitted during today's presentation, we'll be going through those, and we will be issuing a response to many of those through the listserv in upcoming communication, and we'll also update the FAQs on the website accordingly. So again, we want to thank you, and I guess we'll plan to see you at the next public meeting. Thank you so much.